In certain cases, you know, the patient has really low retentive preps. And again, it's when you're cutting off old stuff and you're hoping that the dentist that came before you didn't make the preps look like a TP, right? So when I do get cases like that, I do want something that's really adhesive. I do want something that's really sticky. So you can take a look. She's got this zirconia bridge going from 6 to 8 here, right? She's got some pink porcelain built up. You know, the aesthetics, the cosmetics of this, it's not horrible. Like I've seen worse. I'm sure you guys see worse probably every day in your practice. You know, as a specialist, I see a lot of this kind of stuff. She had a little bit of recurrent decay going on underneath this. So unfortunately we had to cut it off. She'd only had this for a couple of years. Whoever did it, you know, they only did it a couple of years ago. And it was only when she really started talking to me about, you know, the shade and the shape of these teeth that she really started to notice just how unaesthetic this really was, right? And so I've kind of brought her down this dark journey of seeing things the way a prosthodontist and lab technician does. So we cut off the bridge, and this is what we see underneath. So here's the final result. And again, I'm using the G-CEM ONE with this case because of these very short retentive preps. So when this gets cemented on there, I am light curing through there. Even though it's zirconia, you can still light cure through it, especially with a lot of the new highly translucent zirconias. And again, as soon as I've tacked that down, I'm running some super flawless under that. Make sure I clean that out really, really well. You can see on the lower teeth there where we've checked the occlusion. We've already gone through all of our, you know, excursives, and, you know, we've done what we had to do. So the patient was really satisfied with this. She was really, really happy. And again, that's just another one of these cases that, you know, this cement is slowly like seeping its way into my arsenal for more and more cases every single day.